Thank you, Mr. Scott, and thank you, Madam Chairwoman. And just very briefly, again, I have the highest regard for Mr. Byrne, and it seems like we've been doing this a little bit lately in terms of having some good, healthy dialogue on different issues. But the point that I think the Harvard Business Review made is that, yes, HIPAA exists, and insurance carriers are regulated by it, and doctors and hospitals and healthcare providers are regulated by it. The problem is with the existing system of wellness programs is they're not the ones collecting the data. It is third-party vendors. It's not even the employer who's collecting the data, and they're not covered by HIPAA. And that's really what the report that I submitted for the record made very clear, and that's why we're seeing is these organizations are free to do with that information whatever they like, and it's being done in many instances even without the knowledge of their clients, the employers who are hiring them in good faith to collect this data. So my amendment, again, is very clear. It's not just restricting employers from using data or selling data. It really just makes it a blanket prohibition so that non-HIPAA regulated entities are not allowed to turn around and sell people's health information. And I appreciate the point he made regarding the NLRB rule, but I would just point out that we're talking about something a lot different here. The NLRB rule was about data or information about where you can call somebody and what their address was in an organizing drive. What we're talking about here, again, is somebody's health records and their kids' health records. And to me, that just is at a far different level in terms of seriousness, and people should not be able to use that information to turn around and sell it. And that's what this amendment seeks to stop. And I yield back.
Gentleman from Virginia yields back. Are there any other members seeking recognition? If none, the question occurs on the amendment. All those in favor say aye. Aye. All those opposed say no. No. In the opinion of the chair, the noes have it, and the amendment is not agreed to. The gentleman requests a recorded vote pursuant to Rule 13B of the committee and House Rule 11-2H, and as is the committee's practice, further proceedings on this amendment shall be postponed. Mr. Polis?
I have an amendment at the desk. Amendment number 4.
The clerk will distribute the amendment, and Mr. Thompson, you're recognized.
Madam Chairwoman, I reserve a point of order on the amendment.
The point of